genital herpes, hepatitis B virus. We also have the HIV virus, hepatitis, human papilloma virus or the HPV, there's syphilis, and trichomoniasis. So there are some STIs here that are a bit more common than others. Some that are maybe new for some people who have had for the first time. And as we go along with the conversation, where some of them will go into a bit more detail, but as I alluded to earlier, there are lots of similarities among them. We can go to the next slide. Next slide, please, for answering challenges.
Dr. Nafisa? Oh, okay.
Oh, yes, okay, thank you. So below are some of the challenges that that are encountered by the deaf community. Deaf individuals often face higher STI infection rates and greater sexual vulnerability due to significant barriers in accessing health information, education, and prevention methods. This normally stems from communication challenges. So you can imagine a scenario where someone has come to the hospital either because they want to seek information or are having some symptoms. There'll be a challenge in communicating those symptoms to the healthcare workers. Challenges in the healthcare workers adequately assessing the patients from what the symptoms they've described. And the fact that most hospitals or the way the hospital is set up is not geared or tailored to people in the deaf community. So there's also a lack of accessible resources in sign language and societal exclusion. There's a lot of research that indicates that higher STI episodes occur in deaf populations compared to the general population. These are linked to factors such as early sexual debut and increased numbers of sexual partners and low condom use. Okay, thank you. Now you can go to the next slide for challenges. So below now are now some general challenges that people encounter. One thing that has been very challenging in managing STIs in the hospital setup are that a lot of infections are asymptomatic. What that means is that someone could have an STI and have no signs or symptoms, but the infection is multiplying, and the patient can even get complications without necessarily having any complaints. This is a big challenge because most people come to hospital because they feel sick. They come to hospital because either they feel they have pain, they are bleeding, they are feeling uneasy. So the problem with the majority of STIs being asymptomatic, meaning there is no sign or symptom, someone can remain with the disease and it can continue being spread, and the patient will not get any treatment, and things are getting worse. That I'll say is one of our biggest challenges in as we discuss these STIs. Another challenge is the stigma and shame. There were still on challenges. So with the stigma and shame, patients are not able to come to report to the hospital. You can imagine now you need to have maybe an interpreter explain your symptoms, and they are not, so you're already feeling unease, telling the doctor your symptoms, but not even another person in the room. We also have high issues of the expensive cost for tests and for screening. So sometimes there's a lot of misdiagnosis because sometimes a lot of diagnosis is based on clinical, not necessarily on a specific test that is done. This sometimes is done to reduce the cost for the testing and the treating. We also have challenges of antibiotic resistance. I'm sure a few months ago, you had heard in the news about something called super gonorrhea. It was a gonorrhea that was not responding to any antibiotics and continued to spread to the point where it even spread to the whole body. So we're also having some issues where we are creating almost some super bacteria that are sexually transmitted and are not responding to any antibiotics. Another challenge is loss to follow up. We have a lot of patients. Sometimes either they don't complete the treatment, they don't come back for follow up. Sometimes there are some STIs that you need to have a checkup after 3 months later to find out if the patient improved, if there was any antibiotic resistance, if they need a second line antibiotic, if we're able to trace their contact. So that's one of our challenges that we have in managing this condition. Another challenge is that a lot of STIs increase the risk of someone acquiring HIV. Yeah, thank you. We'll go next to the goals of treatment. One of the goals of treatment is to alleviate symptoms. So this is if someone has come with a discharge, pain, bleeding. That's one of the goals that we have when we're treating a patient. A second one that does not get as much attention is that when we're treating a patient, we also want to prevent any future complications, which we are going to discuss. And lastly, another reason why we treat is to break the cycle of transmission. The reason why this STI spread is that once a patient has been treated, at least we break that cycle from going now to the next patient. So here are some common STIs that you should know about. There are some here. Some that I showed you a picture before of chlamydia, one of gonorrhea, syphilis. There are some also that are not so commonly known, such as HPV. It's quite common. The truth is, sometimes we get cases of even up to 60% of patients having HPV. The reason why it's so high is that, as again, I told you there's no symptom. So if there's no symptom, someone will not present themselves to the hospital. So another one is herpes, hepatitis B, hepatitis C, and HIV. Next slide. So here we're just going to talk about some common symptoms. We'll start in men. So we have symptoms such as pelvic pain. A patient can also present with blisters or ulcers in the genital area, in the mouth, in the bottom, or in the rectum. Someone can present with a burning sensation or pain when peeing. Men, sometimes they can have pain in the testicles, swelling, or even pain during ejaculation. Some can have also an issue with needing to pee more frequently than usual, even having to get up to go to pee. And some can also present with a discharge coming out of the penis. Can go next to the next signs and symptoms. So some common STI symptoms in women. Some as you see are similar, some are different. So you can present with also abdominal pain. Also can present with pain lower down and the pelvis, the pelvic pain. They can present with pain during sex. They can also present with vaginal bleeding. They can present with blisters or ulcers in the genital area. They can also present with pain or a burning sensation when peeing. They can also present with an unusual vaginal discharge, can be yellowish or green, and maybe foul smelling. They can also present with a rash or an itchy feeling in the groin area. Okay, next slide. So below are some complications. So patients can present with complications such as infertility. They can present with ectopic pregnancy. There are several types of cancers that are associated with STIs. Like HPV can cause cervical cancer. Hepatitis B can cause liver cancer. And then we have HIV, which can lead to Kaposi sarcoma, which is a kind of a skin cancer. Other complications can involve the scarring of the genitals, so that even after the treatment of the STI, they are scarred and do not retain the same looks that they have had before the treatment. So this is one of the reasons why we aim for early treatment and complete treatment to prevent scarring. You can have the narrowing of the vagina and distorting almost to the point where it's almost impossible to have intercourse. We have some STIs that can spread to the brain and cause meningitis. We have other STIs such as syphilis, which can spread to the heart and can cause an aortic aneurysm, which is just like a ballooning of the vessels of the heart. They can also spread to the baby, and a baby can get congenital syphilis. You also have cases where it can spread to the brain of the patient, like in the later stages of syphilis, causing neurosyphilis. We have cases where a patient can, if pregnant, can get preterm delivery. STIs can also cause miscarriages and can also cause babies to be born or low birth weight, and can also present with liver failure. Next. So now we're going almost to the heart of the talk for today, which is prevention. So number one, I was put there, abstinence, of course. As we said earlier, these infections are caused by intimate contact, and the only, of all these methods, the only one that is 100% effective is abstinence. The second one we talk about is consistent condom use. So it's not just condom use using once or inconsistently. It means consistent condom use for each sexual activity with each partner. And the way it works is that it acts as a physical barrier. And it's the only contraceptive that not only prevents pregnancy, but also prevents spread of sexually transmitted illnesses. Next, one that's not maybe talked too much about is vaccination. So we mentioned how HPV, it's a virus. It normally has no symptoms, and it's known to cause cervical cancer. It is preventable through vaccination. We normally target girls and boys around the age of 9 to 11. And sometimes we also have something called catch-up, where maybe patients who maybe are up to 25, and in some rare situations, maybe up to 40, you can still give them the HPV vaccination to prevent that them acquiring that infection. Hepatitis B is also a virus that has a vaccine. Most of us are given as children, and it prevents against getting liver cancer later in life. A fourth one for prevention is that does not happen quite often in Kenya. In a lot of countries, this is actually almost mandatory. They have a lot of STI clinics which are free, which anybody can just walk in and go for screening, at least even just once a year. So they highly recommend that at least once a year, for those who are sexually active, some countries target people who are below 25 to go for screening for these STIs. Remember, a lot of them have no signs or symptoms. So you just walk in, you get your blood test, they'll check for HIV, they check for syphilis, they check for hepatitis B, for hepatitis C, for chlamydia, gonorrhea. If there are any that are positive, you're given the treatment there, and you go home. Number 5, limiting the number of sexual partners. This is because studies have shown multiple sexual partners increases the risk of acquiring STIs. And as we've said, some STIs even increase the risk of getting HIV. For example, if someone has syphilis, it increases the risk of getting HIV. Someone who has herpes has a higher risk of attaining HIV. And that's why in the hospital setup, if someone is found with one STD, we test all of them. Because sadly, a lot of them come. They do not occur individually, but they sometimes occur as groups. Number 6 is about abstaining from sexual intercourse during treatment. So usually, as a general rule, we try to advise people when they're on treatment to at least abstain from treatment at least up to 1 to 2 weeks during the time they're taking the treatment with them and their partners. This helps to break the cycle of reinfection. We've also talked about treating sexual partners. This is whether they have symptoms or not. Remember, a lot of symptoms of STIs, there are no symptoms. Next is about early diagnosis. Remember, a lot of these conditions, we said the earlier you treat, the less likely they are to get a complication. If you are to treat chlamydia early, it does not lead later on to infertility or ectopic pregnancy. But if it is delayed, it leads to those complications. Another example is syphilis. Syphilis, if caught early, will not lead it to spreading to the heart or to the brain, and you can contain it when it's still early. Number 9, good personal hygiene. This is because a lot of infections sometimes they are highly associated with poor personal hygiene. So I just talk about the regular washing with soap and water, and that's what we're talking about the good personal hygiene. Number 10, immediate treatment after exposure. So we've had cases, I'm sure when you've heard of HIV, of post-exposure prophylaxis. So those are there are medications these days that are there that are able to even prevent someone from getting an infection, even when the risk is very high, like in those situations for PrEP for HIV. Another public health initiative we normally have for prevention is early antenatal care visits. So especially for syphilis, if a patient was to start clinic early in the first 3 months, you're able to detect the syphilis early and treat it and cure it early. If someone was to be found with HIV, they can be started on treatment, which will reduce the viral load and reduce the risk of transmitting it to the unborn child. Early antenatal clinics also help us identify herpes or any of these infections, because as we said, one of the complications of having an STI when pregnant is that you can get a miscarriage, you can get a preterm delivery, you can get early, the water breaking early before the baby is due, and having an early antenatal visit, we normally screen for these STDs in pregnancy. Number 12, we normally treat all newborns born after birth with antibiotics. It's called tetracycline eye ointment, TEO. And the purpose is that one complication of a child being born with a mother who maybe has gonorrhea is that they can get a very severe infection of the eye, which can even lead to blindness. And one of the public health things is that we give all babies that tetracycline eye ointment to reduce the risk of getting that eye issue. We give all babies, regardless of whether the status of the mother is known or unknown. And number 13, circumcision for men. It has been shown to decrease the transmission of HIV, especially in places with a high HIV burden. So to my last slide, the take-home message. So number 1, we've discussed how STIs are infections spread by intimate contact. So it's very important to know it's not only vaginal intercourse, because we've had cases where people think they don't need to use a condom or they don't need to use any protection because it was oral sex, because the person thinks they cannot get an STD oral sex. It is spread by vaginal sex, anal sex. All of those can cause spread of an STI. Is that they're asymptomatic. Asymptomatic meaning there are no signs, there are no symptoms. So someone can look completely fine. They're not coughing, they don't have any discharge, they don't have any pain, and they have the infection. And that's why we're really advocating for going for the annual screening. where every year the common STIs are screened for. Number 3, the goals of treatment. Normally, when you go to the hospital, this is what the doctor is aiming for. If you have any symptoms, to stop those symptoms. If there's pain, we want you to stop having pain. If you are bleeding, to stop the bleeding. If there's a discharge, to stop the discharge. That is what we mean by alleviate symptoms. Number 2, we want to prevent complications. You have seen there are so many complications that happen if the infection is not detected, if it is detected late, or is not arrested in time. So we want to prevent all those complications. We don't the genitals to be scarred. We don't the infection to spread to other parts of the body, to the brain, to the heart. If a patient is pregnant, we don't want them to get any complications with the baby from either blindness or early delivery or any miscarriage. And lastly, we want to break the cycle of transmission. We don't the infection to spread to either to the unborn child or to the patient's partner. Number 4, these are preventable, and we've mentioned all the different ways of preventing, from abstaining to use of condom, consistent condom use. We've talked about vaccination against the infections that are able to be vaccinated against. We're talking about limiting the number of sexual partners. We've also talked about good hygiene and about circumcision, and also about generally just being aware. A lot of the challenges we get is lack of awareness. We don't know that these conditions exist, or that, for example, that someone can look completely fine and still have the infection. And lastly, that they are treatable. The top 4 most treatable STIs are like syphilis. Syphilis is normally just treated with an injection of penicillin. We have bacteria like chlamydia. It's treated with antibiotics. We have some viruses like herpes. It's normally treated with antivirals. And we have others also like trichomonasis, which is also treated with antibiotics. Others like HIV are treatable and manageable with antivirals, with ARVs, antiretroviral drugs, to suppress the production of viruses in the body and to reduce the chances of transmission, and to make sure the person's white blood cells are not depleted so that they're able to fight off infection. Thank you. Hope you've been able to follow along, and hopefully we'll be able to take any questions.
Yes, we have one question from Lensa.
Yes, just share with me the question.
I want to get it from her. So Lensa is asking. So sometimes I was able to. There's some words are very difficult for us, but it's okay. We will be able to learn. So, but I think it's very good for us, maybe as we're having very important these topics. So maybe we can be able to include maybe, for example, we do not have other deaf that do not have a social media account. So is it possible for you to be having these physical lessons so that you can be able to advise the deaf youth, those who do not have smartphones, because some of them do not know maybe about the hepatitis. They want to learn, but maybe they do not know about it. So for example, some of them say cancer is caused because of too much meat. So how can you be able to advise them? So if it's possible for you to have maybe physical meeting with the deaf so that you can be able to advise them on the same. I don't know if that is okay.
Yes, yeah, thank you. Yeah, that's also okay. Yeah, because of course there are always advantages and disadvantages of doing it online versus physical. I think one advantage of online has been we've ever had cases where we even discussed with over 1,000 people and maybe even people who are not necessarily in Nairobi, who are in Coast, Kisumu, can join in. But there are also always, of course, advantages of having a physical one-on-one talk. You know, sometimes maybe someone might be shy or something, someone might need a more clarification. So I think that's something we'll pick up with the organizers. If I'm available, that one is just agreeing on a date and time, and maybe even a topic that maybe they are interested in, that they would like more info on. So I think both are good avenues. Thank you.
So she will inform her deaf friends on the same, because they're very interested, but they do not have they do not have smartphones, some of them.
That's okay.
Also, as part of the DeafHealth organizers, thank you so much, Lensa, for bringing it up. We definitely will be reaching out to the speaker and all other speakers and try to see the availability for a physical meeting. So we have taken your suggestion into consideration and we shall work on it. Thank you so much.
I've seen a question in the chat box. I think someone was asking, is chlamydia, syphilis, and gonorrhea fully treatable? So I think, yes, as I was alluding to in the end, they are treatable. For example, chlamydia, funny enough, chlamydia is very easy to treat. The challenge we have, chlamydia is almost the most common STI in Kenya. The issue is that as much as it is very treatable, because it has very few signs and symptoms, that's why it spreads so much. That's why I told you chlamydia is even more common than HIV. And it causes so many complications, especially when women get into their 30s and 40s, especially with infertility, because chlamydia causes tubes to block. It's also responsible for a lot of ectopic pregnancies. And chlamydia is one of those things that causes a lot of pain, a lot of pelvic pain, and because sometimes it causes something called almost like something called like adhesions or like scarring inside the reproductive cavity. So chlamydia very easy to treat, but the issue diagnosing. Most people don't think that they have it. Another one is syphilis. I told you syphilis is very easy to treat. It's just one injection of penicillin. But again, most people, by the time they realize they have syphilis, it might have already have spread quite far. But remember, syphilis, that's why we are really advocating for screening. Gonorrhea also, I told you, even gonorrhea is also just given a single tablet. But again, I go to, some people might have gonorrhea but have no symptoms. So we are really advocating for screening. Talk to your doctor at least, even when, don't only go to the hospital when you're having very big symptoms. Maybe I've just seen maybe one more question. Is there awareness for children with HIV in deaf schools? Do you visit schools for sensitization? Yes, when schools do invite us, we go. I know it's not that common. I think I know of even sometimes when we go to churches. I know there's a church recently that wanted to have a talk on some health condition. So when invited, we're very available. As I said, it just depends on just aligning the calendars when is available. Maybe about awareness for children specifically and HIV. I'll be honest, I don't think there's much information out there. I know most of the target age group people have been targeting maybe people who are in maybe high school, maybe people who have just finished high school, maybe children. I'm assuming you might mean children in primary school. There's not so much awareness about that. I know in universities there's really been a big try to try and get people to have at least one class on HIV, a formal class, to be mandatory for all first-year students. But I've not seen that yet. It has not yet been implemented into the school program. So thank you. Someone is asking, please say something on breastfeeding of babies born of HIV positive mothers. So something interesting about HIV, I told you there are 3 ways it's spread in pregnancy. It can either be spread during when the mother is carrying the baby. Number 2 is during labor, and number 3 is during breastfeeding. So these days, the reason why we're advocating for early antenatal clinic is that we can detect if someone has HIV early in the pregnancy. If positive, we start them on treatment. This will reduce their risk of getting passing the HIV to the child during pregnancy or during delivery or during breastfeeding. With the technology that we have these days, as long as there's something we do call viral load, we are able to test if the virus has been suppressed in the patient's body during while they're on treatment, and if they are compliant and they're taking the medication well, and if they have maybe any other STIs. The current guidelines are as long as the viral load is suppressed, I think, and as long as the mother is coming for the follow-up. There's even medication that we give the baby once born to now also reduce the chances of the baby getting infected. And I think there's after a certain point of time, we retest the baby. And if I can be honest, majority of babies who are born to mothers who are HIV positive, and I'm sure I've also had a lot of cases in the media, are HIV negative. As long as I told you, as we catch them early, we suppress the viral load. Almost, I think, 99% of babies do not get transmitted the infection. The few who you hear who do get, most likely it was either started very late, or we have cases of poor compliance with the medication, because of course when you don't take the medication, the viral load goes up, or compliance. There's another question. Is it then reversible at an advanced stage? Understand. For chlamydia, I told you yes, it's 100% treatable, but actually because it has no symptoms, if it has been there for 3 years, it has been causing damage for 3 years. So let's say we find out today, let's say the person has not been going for the screening, and as we said, it has no symptoms. If we find out after the 3rd year, yes, we will give you the antibiotic and we will treat you, but it might have already damaged the tubes. That's the best way of looking at it. It can be treated, but you need to treat it before getting the complications.
So we have one from Lensa. So sometimes sometimes the deaf people feel a bit shy to go to the hospital, because sometimes when we go to the hospital, we have some doctors are there, but they do not know how to keep secrets, so they will inform other people. So that's why we sometimes feel very weird to come to the hospital when we have the early symptoms. So how can you be able to help that?
Yes, of course. All healthcare workers are supposed to have to be professional, and that's why even if the president was sick and went to see a doctor, the doctor is not meant to write, for example, on social media, the president came with this problem 1, 2, 3. It is almost meant to be like a priest. The way you go to a priest and confess your sin, the priest is not meant to go and discussed with everyone in the congregation. Actually, that's why STI clinics and even clinics that deal with very sensitive matters, HIV, even the location they are in a hospital is normally very different. It's meant to be somewhere that's easily accessible. It's meant to be somewhere where there's some confidentiality. We're not even meant to mention your name. You're just meant to use maybe your initials. Just for example, like me, you say KM. You're not supposed to say the patient's name. And when you're having a discussion with a patient, the door should be locked. It should not be in an open area where anyone passing by should hear the conversation. Even when giving results of a patient, you cannot give a patient the results of another person. We sometimes have that challenge in hospitals. We've had cases where someone comes with their house manager and says, test them for HIV, for syphilis, for chlamydia. And we normally inform them, we will test them, but we will give the results to the patient. It is not for us to give the results to the employer. Of course, if there's a case of a doctor giving the results to the employer, that is illegal. And the truth is you can actually be taken to court for sharing private information. So all those things are meant to be done with confidentiality. The results, whether negative or positive, you're not supposed to post someone's results. I think there's a lady about a year ago, she got in trouble because she posted the boyfriend's HIV results on social media. So whether they are negative or positive, that one is illegal. You are not allowed to share someone else's status online. You might land on the wrong side of the court. So even those doctors or healthcare workers who are unprofessional, sadly things might catch up with them.
So I have one question from Samuel. So we have about all the different STIs that you have taught at. I have seen them. That is very nice. So I want to ask you something. So for example, if maybe I do not know about all those symptoms, for example, maybe syphilis or all those that you have taught us, and you've encouraged us to go for the screening yearly. So which are these hospitals that they can do it, or can I do it after maybe 2 years for the doctors to be able to do those screenings, or how is it supposed to be done? So is it okay maybe if I don't go for a year, I go after 2 years, or which hospitals do really offer that services?
So good. So number one, about when someone should start the screening, I'll give an example. Some people have been sexually active maybe since they were 16, and now the person is 20. It's been almost 4 years. That person should have gone for screening when they started their sexual debut. That was at 16. It means they are 4 years late. If they got any infection at age 16, it has maybe been going untreated for the last 4 years. That's why we recommend once someone is sexually active, it should be once a year. Once a year. And I told you, any major hospital will have the test. It's normally just called STI screening. STI screening. So just talk to your doctor, any level 4 or 5 hospital. They'll understand that we've been getting this awareness about these diseases. We've learned that some of them don't have any signs. I'm sexually active, and I would like to go for this STI screening. Remember, you should not go for the screening when you're feeling sick. Sometimes if you're feeling sick, it means it has probably been there for some time. We want you to go even when you're feeling well. A good example is HIV. When someone has HIV, they can go almost 11 years with no symptoms, no signs, no problem. So we would not want, for those 11 years of you being sexually active, it has been spreading, and I said causing complications, as we said. By catching these conditions early, we prevent it from being spread, and we prevent any complications. So I would recommend once a year, and any level 4 or level 5 hospital, just ask them about STI screening.
So thank you, Dr.
Yes, thank you so much. It's been a pleasure. If there are any, as you said, any recommendations about how to make it better, as you said, whether physical or if there are, we'll try use some less easier understandable medical terms, just to make sure that the presentation is clear. Thank you.
Okay. Thank you, Doc. That was really
Doreen, a minute.
Okay.
So kindly, for those doctors here who know sign language, so now these topics are very important. So you can actually have another topic about the dangers of abortion. So we will really recommend that, so that you can talk to our deaf people about that. That will really help us.
Yeah, thank you. Yeah, that's good, because that actually ties in a bit to what we're discussing, contraception, because a lot of abortions come from unwanted pregnancies. These are maybe people who are got pregnant when they were not ready. As you said, condoms are the only contraception that prevents pregnancy and STI. And sometimes you get cases where a patient comes as an abortion, but also has an STD. So sometimes you have to treat both. A patient has to be treated for the abortion and the STD. So I think that's also that's an important topic about contraception, abortion, and at least we've covered STD, STL today.
Samuel has something. So, for example, if I enter on the clinic and then I ask Daktari about the SDI, the level 4 and level 5 that Daktari have told us, how much does it really cost, or is it free?
Yes, thank you. That's a very important question. So it's not free, especially in Kenya. In other countries, it's free, and that's actually why there are very low rates of STIs. I'll give you an example. Like a country like Australia, you can literally walk in, ask for the screening, get treatment, and you go home. So sadly, in Kenya, we've not yet reached there yet. Once you go for the STI screening, you'll be given so every hospital will be different. The charges will depend on which hospital you go to. So some, like in a public hospital, it will be much cheaper than if you went maybe to a private hospital. And of course, even the treatment, in case any condition is caught, the cost of the medication will be different. So for now in Kenya, you have to pay. We have not yet reached that level yet, where you can just walk in and get screening for free.
Sawa, thank you. Doreen, you can take it.
Yeah, so thank you, Doc. That was really a very wonderful presentation. And I hope we've all learned something new, and we will share the information with those who are not able to join this evening Yeah, so at this juncture, I would also want to thank editor. You really did a nice interpretation. That was really good. Yeah. So, Dr. Nafisa, I don't know whether you are still here. Do you have any concern?
I don't have any concern. I just want to share a hearty thank you to our speaker today. This was very, very informative talk, and it was very well simplified. And we are looking forward to having you in other talks where we're going to be educating the deaf community. And we're also going to incorporate all the suggestions we've been given of having more of the webinars to be physical so that we can reach more of the deaf community. But otherwise, I want to thank each and everyone who joined in today. I want to thank our moderator, Doreen, for organizing and ensuring we have our speaker, we have the interpreter, and we have a topic for discussion today. And also want to thank teacher editor for the amazing interpretation she's been doing throughout. Thank you so much. And Doreen, you can continue.
Okay, thank you, Dr. Nafisa. Yeah, allow me to also invite Teacher Sese. Teacher Sese, do you have any concern?
Hello. Am I audible?
Yes, we can hear you.
I really want to use this opportunity to thank Doc and the entire organizing committee who have managed to put this important topic and presentation today. Also to thank Daktari, our facilitator for the day, for the informative session, and to thank our lead interpreter, editor, for the good work that she has done, especially as we continue to working together to empower our brothers and sisters in the deaf community on topics that will not only touch their lives but transform the society. Asanteni sana and do have.
Okay, thank you, Teacher Sese. Yeah, so thanks everyone for attending, and wish you all the best. So let's share the information. Yeah, thank you. And now we can, I think we can now, we are free to leave.
Goodbye.